Hey, good morning. Today I wanted to talk about a course that we went to recently that was at the Align Tech facility in Raleigh, Durham. And we've made several trips to this facility now. Actually, this is the second one. And as a practice, myself, Hector, and Mark have put a lot of time. Hector and Mark are my chairside assistants. And we've put a lot of time into Invisalign recently. And as most things that I choose to put time into, it's something that I think about carefully and think about how it's going to benefit patients. You know, what's going to be in your best interest. And Invisalign, we started with it not through pressure of feeling that, okay, this is something that we have to jump on because it's a trend. We started with it because it is so helpful with what we always talk about, which is form follows function. And if the function is off, it's going to affect the form and vice versa. So many times when I'm looking in the mouth and see that there are things that we can't get there from here, so to speak, with adding porcelain or adding composite, and we need to redistribute the space or move the teeth into a better place, Invisalign is the answer for that. And it's so powerful to be able to do it ourselves and dial that in, as opposed to having to refer that out and then the conversation of back and forth with the orthodontist, which must be frustrating to a patient, because the question is always, am I done? And I'm looking at it like, I would like him to do this, that, and the other, and then we send the patient back, and then the orthodontist does some things, and then they come back, like 3 months later, I'm looking at them like, oh, but now we need to, it's like, you get it, right? People who have done orthodontics are familiar with this. So it's smart, and it's in the patient's best interest for myself and my team to be able to provide this service for our patients. So we have, and just like anything, we're not going to offer this service unless we do our due diligence and be able to provide this at the highest level, right, at a professional level. So that's always been important. You know, we consider ourselves professionals, which means that we promise a service to come through for you to provide the result that you have in your mind. With Invisalign, at this last course we went to called Catalyst, now this course was put on by the Queen of Invisalign, right? Kind of a trendy name, but believe me, this woman has a lot of substance, and she does earn that moniker, Queen of Invisalign. Her name is Christina Blocker, and then we also had Corey Analik. The two together have done so many cases and are such veterans with Invisalign that we were able to glean some really important knowledge on how to go about setting up our cases. So what the patient may not be able to appreciate is what goes on behind the scenes when we're doing your treatment planning for Invisalign. And really, it's like a chess game. You know, it's like we're looking at the whole picture of, for instance, if it's a straight cosmetic case, okay? That's what the patient sees a lot of times. Is, oh, I don't like my smile, the teeth are crooked, they're crowded, I have spaces. That type of end result is a lot easier to visualize, and you're not thinking cause and effect so much as you are an aesthetic result. So that's one level of Invisalign, our cosmetic cases. Another level of Invisalign would be, let's just say somebody wants veneers, but yet the teeth are not in the prime position for us to be able to do the veneers without being aggressive with the preparations. So we use Invisalign. In fact, that's why I originally got involved with Invisalign. We use Invisalign so that we can put the teeth in a position to where we can do more additive dentistry versus subtractive, meaning I don't have to cut the teeth down a lot. We can stay in enamel, which, as you've heard me say, enamel is king. And as patients ask me about veneers, oh, I want veneers, I look at it and I go, we can do the veneers if we can move the teeth to a better position that will enable me not to have to cut in through the enamel so much. So that's the second thing. The third thing would be if somebody's function is off and we're seeing signs of instability in the mouth. Okay, so this is the big one that I wanted to spend a little bit of time on, that patients really don't think about this aspect of why you would think about Invisalign. Okay, it's something that dentists didn't even think about. And a lot of dentists don't think about how they could use Invisalign to help patients under decreasing functional risk. So, we got perio risk, we have biologic risk, which we talk about, we have functional risk. Functional risk is the hardest to deal with, right? Because this is an insidious collisions of the teeth where they're starting slow breakdown, and it's like watching something fail but not being able to do anything about it, and then you end up having to do patchwork dentistry to plug in the holes and the insufficiencies or the structural instabilities that are caused from these collisions. A simple illustration is the teeth fit together, lock and key like, and if the teeth are not in the right position, let's just say that they're hitting like this, right? Well, which tooth is going to break down first? It's the one that's taking all the load. We see it every single day. And as I say, when we're looking in your mouth, I'm looking for clues. Where is that traffic pattern? Where is the, as I refer to, the wear patterns in the carpet where all the traffic is? That's what we're looking for on your teeth. Those are called wear facets. These wear facets give us clues as to what are the teeth that are losing this battle, right? Which are the teeth that are breaking down? What side of your mouth are you always having problems with? Why are the front teeth breaking down and getting jagged? Why do you have little notches at the gum line? Why do you look in the mirror and see cracks developing on your front teeth sometimes? This is what I'm referring to with the function is not ideal. So wouldn't it be nice if we could change that by putting the teeth in a better position so that the function is now, as I say, in simpatico. It's harmonized. It's getting along. The top jaw and the bottom jaw like each other and are able to chew things efficiently without pain, without causing disruption to the enamel of the teeth, because it's not normal for enamel to wear. Sometimes somebody will be in their 50s and say, I'm 50 years old. Yes, I'm going to have wear on my teeth. That is not true. I can show you a very healthy dentition all day long of people in their 80s that do not have the first ounce of wear and disruption to the enamel. Enamel is king. Enamel is so important for your teeth and longevity. And when your enamel at the age of 20, 30, 40, 50 is gone, it's a very important thing to pay attention to and to listen to your dentist if they have an idea of how this can be mitigated. Now, of course, if you've been with me a long time and we've watched this happen, I haven't mentioned it, please, if you notice it, mention it to me, because I haven't been always able to have this conversation because I didn't know what to do about it without having to provide a bunch of crowns and things like this and fillings. Now, what's really nice, if we catch it early and can prevent it, or if we've been watching it for years but now can have the conversation of how to put teeth into place so that we can do some of these restorations to replace the enamel, but do it in an additive way if we put the teeth in the right position. So there's so many things to talk about here, but I will close with just a simple thing that we see a lot, and patients notice it all the time, which are these notches at the base of the teeth and recession. Okay, two different things. You can have, if you look in the mirror and you're noticing, and you're like, oh, it's typically on the side a lot of times, that the tooth looks like it's getting a little bit longer. Now it's yellow at the base of it. Patients ask me, why is it discolored there? It is because now the enamel is now exposed where the enamel and the root of the tooth meet. That's called recession. It's exposed because that tooth, if it's getting hit, it rocks it and it will move the gum up the tooth, and now it exposes the underlying dentin or root of the tooth, and that's softer than the enamel by 9 times. As you brush, it wears away, and sometimes it just pops off as the tooth flexes, which is the recession and abfraction combination. Oftentimes it can be sensitive, which is why you see on TV all the commercials about sensitive toothpaste, Sensodyne. Sensodyne makes millions from that, and the reason why is because these things hurt a lot of times. You drink cold water, it's like, oh, I need to talk to my dentist because my teeth are sensitive to cold. Well, as long as it goes away right away, we're not dealing with a serious root canal issue. What we're dealing with is root sensitivity, and Sensodyne just puts a Band-Aid on it. You need to ask yourself, why is this happening? Ask your dentist why it's happening, and most times it is because of your occlusion, your bite, these collisions, and you can put a filling on it. It's going to decrease the sensitivity a lot, but it's still not getting rid of the cause. And there is where the Invisalign conversation comes into play. Even if you look at your teeth and say, my teeth are straight, why in the world would I need Invisalign? Well, on closer inspection, you may notice that oftentimes these teeth look like they're coming in like this, and it's like, yeah, I've noticed my smile is a little narrow and they kind of cave in on the side. Form follows function, right? If that form is off, you better believe the function is going to be off. And by taking those teeth and moving them out, it looks better, but it also functions better and can get rid of these collisions that can compromise the structure of the teeth. Perfect example.